But it's okay. I am Maria Fernanda Detanico. I am from Porto Alegre, South Brazil. I am a trauma surgeon. Also, I do the coordination of the residence programs in my hospital here. It is Cristo Redentor, that it's in Porto Alegre. We have and I was also, I used to work in one of the hospitals that we're going to show what happened to it. So,
Maria Fernanda, could you please just share the whole screen? So I think you are not in presentation mode in your PowerPoint, please.
No, yes, I'm starting. I think now it's
Perfect.
Okay. Perfect.
Yeah, let's say some words. So Dr. Parreira from SBITE is here, going to introduce us as well. We have this meeting happens on once a week for almost 15 years right now, and he uses opportunities to share the knowledge or some mass casualty incident happened before. You had the same meeting after the Boston Marathon bombing, the same meeting after the nightclub fire that had happened in Santa Maria some years ago as well, after Haiti earthquake as well, and now he's having this devastating event in the south of Brazil, and is a great opportunity to show international collaboration, and the World Coalition Trauma Care are going to be here represented as well, and Dr. Gustavo Parreira from SBITE, our friends from SBITE Brazil, very grateful, graceful to make this meeting happen, and thank you, Maria Fernanda and Roberta from SBITE Rio Grande do Sul for being able to present. I know that you're all busy, but it's very important for us to understand what's happening and maybe share some knowledge here. Dr. Parreira, your initial words, please. Dr. Parreira.
Antonio, well, I'd like to thank Dr. Maria Fernanda and the great team of trauma surgeons in Rio Grande do Sul. Rio Grande do Sul is a state in the south of Brazil, and we are all expressing our condolences for the victims and for our deep sorrow for what they are going through. And as the president of the SBITE, for us, it's a pleasure having them there representing our society and having this opportunity to share all the knowledge they have with us and with the guests here. Thank you for all. I'll be driving here. Well, I won't be able to participate in the discussion, but I'm here. Thank you.
And Dr. Roberta Dalcin going to be the moderator, right, Roberta? Thank you for being here today. You can lead the meeting, please ask questions, etc. Thank you.
Thank you. We can start?
Yeah. Please.
Yeah. Maria?
Okay, so as I told you, I'm a trauma surgeon. I work here in Porto Alegre, and we are going to present a little what is happening here in our state, that is Rio Grande do Sul. And it's impossible for us not to say how it was the response before saying what happened and how is our state before all this chaos. So, vamos ver como é que eu passo. Ótimo, não vai. So as I told you, we are the southest state in Brazil. We are close to Argentina and Uruguay. Our population is about 11 million. Our capital is Porto Alegre, and more or less we have 497 municipalities. So what happened? So in April 22, we had some meteorological alerts, some talking about really heavy rain in many places in our state, not only in the capital, that it's Porto Alegre, but in a lot of municipalities. So, and it started to rain really, really, really heavy in this area here. I don't know, I think it's showing. So this is one of the rivers, that is Jacuí. In many of these parts of Rio Grande do Sul started really heavy rain. So one of the river gets bigger, and this one gonna flow to our, that we used to call Guaíba River, that it's a lake that we are not so sure, but it's what really is. Even here also, this is Rio Gravataí, this is Rio dos Sinos, River and this is what happens in all of these places. In the beginning of the rivers, it start to really have a heavy rain. So, and it goes all of this, and in 1st of May, this is starting to get into Porto Alegre because of the river flow. We also have a really heavy rain also in Porto Alegre, so it's a mix. And just to show here also, this is one of the lagoons that is Lagoa dos Patos, that it goes through the Atlantic Ocean. And also we have, with all the heavy hands in the part of the rivers, we also really have rain here in Porto Alegre, and also one of the winds that makes easy the water to go through the ocean. It was not the ones that was making easy. It was the worst one, that is the southwest wind. So it makes a really bad situation. So basically we have a lot of rain, overflow of the rivers. Our capacity of draining also, it was not good, about infrastructure, pump systems, a lot of problems, deforestation also. And this is in the end, this is what happens to our city. This is our historic center. Also, this is, I think it was not when the thing really get worse. Even we can see some cross line here, and it was really worse than this. This is our historic center. This is the beginning of the city. We used to have some marks on the buildings, because we have also in 1941 we have a huge flood, and everybody used to say about the flood of 1941. And this is again. Also, this is the main access by driveway. So we have, as you can see, like it 3 lines. We can go from many parts of the state, and it was completely underwater. So complicated for us also to go to other places. This is one overview of the city. Here is what we call the Guaíba River. So we also have the river Jacuí, Gravataí, Rio dos Sinos over here going. So this is one of the football stadium, that is the Grêmio. We also have this other part that is through the riverside also, that is Internacional, also a soccer stadium. This is what is played the World Cup. And all of this is not even close to normal what happens to this. And this is what I was told before. This is one of my hospitals. It's a city that is close to Porto Alegre, that it's Canoas. And one side of the city, we have like a big railroad that separates the city into parts. One part of this is completely underwater like this. This is one of the 3 major trauma hospitals that we have here in the state. That is a first aid hospital. And it's the first floor is completely under the water. And here we have the emergency room. We have one ICU. We have the operating theater. We have radiology. We have a lot of things that completely lost through this because of this flood. We also have, as you can see here, we have one base of the ambulance that we have, the pre-hospital. So we have also the ambulances completely also underwater, because there was no time for them to leave. It was not safe. So this has happened from the night of the May 3 until the morning. It was Friday night until Saturday morning. This is what happens. Some of the patients was of this hospital, they are evacuated through the window with really, really complicated by boats also. We need to evacuate the patients by boats, by this way. This is one of the scenarios. This is what we are talking. During this, we have to evacuate. This was the first hospital to have the need to do the evacuation. It was basically by, as I told you, like boats, small boats to do this. This is what was happening. and it take all Saturday day, even the night, to do this. Also, we have another cities that were completely devastated, as Mussum. This was the third flood in 1 year, and by this time it was 800 of the city affected. Eldorado do Sul also, that is a small city near to Porto Alegre. Basically, it's a city, a sleeping city. Also, we have all this chaos, 40,000 people, and 2/3 of the, no, I don't know, 3/4 of them completely displaced. So at the beginning, what happened? We have some warnings about the water was getting high. Some of the people leave their houses, some of them no, and some places it was really really quickly the level of the water. So this is what happens. This is in Canoas. We say that it's one of the neighborhoods that is Matias Velho. That's the place where the hospital is in. So we have a lot of these small boats, and this is basically, we have some people of the civil defense, that it's a government structure for this situation, but we have a lot of civilians getting here with some boats and taking people off the water with jet skis and all of this. This is one video just to show also what happens during the evacuation of the hospital. So we need to have the civilians to help. It's one hand to another and pulling the boat with some patients and some people also. This was Saturday night already. Let me see now. Okay, stop. We also had the army and the Air Force to help. Some of the cities were completely separated because we're taking a look of the map. We're gonna have a lot of roads that they are distracted by the rain, and some also some of the land that was displaced and destroyed. So some people were really a part of everything, so it could not leave their houses by land or even by boat. So we had the help of the Air Force with helicopters. I think you saw this picture, and I think if you're not, it's being used as an example of the fashion world now, that is resilience, that is the capacity of I don't know if the capacity of standing up in all of this. This is a horse that we used to, that now is better known as Caramelo horse. He was there for 3 days on the top of one of the houses in the same standing position until he got rescued with the help of veterinarians and the firemen. And they sedated this animal to put on the boat and to go to a safer place. And he's okay. This is our symbol now. So more or less what we have, it's about 8,000 people rescued from their houses by this way. As I told you, we have a huge support of the civilians to do this. We have a lot of people from other states, other cities of Brazil, that they just took the road and go straight ahead to be here to help us. We have also 12,000 animals rescued between horses, dogs, cats, chicken, pigs, and all of this. We have some places that were used as rescue points. It's exactly like it's the places where basically we have some aid of the federal policy, but and some government structures, but also, as I told you, a lot of civilians. This is civilian, and they're using their own cars to put the boats on the water to get the people back. And also in these places, what we have, was a health structure that it's here. This I forgot the name. Roberto, se lembrar barraca, help me. So we have this structure that it's something that we started. Tent. Thank you. Tent. And what we are doing is doing some triage first to see who need a better stabilization, especially because hypothermia, anxiety crisis, and all of this. So this is what were the beginning, and they were the people were sent to some shelters that it's all over the city. This picture also shows one of the major symbols of our village, that is used to be a light in the beginning, a light usine. This is, I think, in the beginning of the 20th century, and this is gasometro for us. So it's very impressive to know what happened. Now it's a museum, but the water normally is not this. So we have, as I told you, you can see a lot of civilian, and this is were organized by civilians with the help of some people. Also, we had another rescue points. We always needed the policy because, well, you know, the violence is not so easy here. Also, what happens to our airport is this also completely underwater. So we cannot leave the city, we cannot get into the city. Even me and Roberta, we were in the European Trauma Congress. It was a little bit hard for us to come back, to be here, because we cannot leave we cannot get by plane. You can see also here the flood. This is not the common, and it's, as I told you, complicated for us to leave or to get the medication supplies at all. It's complicated also to get here and also to live here, because Porto Alegre become the major donor center, as we can see. We have a lot of things coming to Rio Grande do Sul from all over the Brazil, and we cannot leave, we cannot send them because of this. And also we have the roads, as I told you, destroyed. One of the city completely could be a part of each other. This is in Lajeado also. That is two major cities also has a good structure, completely underwater. As you can see also, we can show this in the red. It's the roads that are blocked. So we cannot connect the rest of the state with Porto Alegre unless if you use the helicopters also. And in some places here, especially in the Northeast, the weather was not good at all for some of the helicopters. So they were doing in the middle. They are trying to do the way through some forests that we still have here. During this, we need to think about what we're going to do, how we're gonna manage the situation, because we need to create an access. So they started the humanitarian corridor that's just basically some land and some rocks, so we can connect again Porto Alegre with some part of the state. Basically, who are using this is for transportation of trucks, and now we can have the health people, doctors, nurses, by this, we can use this to go to the other places. Also, we had another problem in another 2 villages that also close to Porto Alegre, and because they got blocked because of the river also, so another humanitarian corridor was made by this also to connect. We also, as I told you before, we have many people, many areas. We have also the government here by the military forces. So we have the Marine here that is now in the south, the part south of the state. That is where we have a harbor. It's a huge, for us, it's a huge ship with capacity for a hospital capacity. So if needed, we can use this. We have the helicopters, we have the firemen from many places of Brazil, São Paulo, Paraná. They send us to help us. We have also some field hospitals that are doing at least this not so complex cases, because at now, with the beginning of, for sure, we have more hypothermia and all of this, but all of the other diseases, they're still going on. So we don't say to the flu, you cannot, now it's not the time to do it, but so the flu keep going. And for us now it's the beginning, the winter time. So complicated also because we have a lot of people inside the shelters, and all this situation, this stress and this weather and all of this, we know that it's going to increase this in very few days. So this is already on the field hospitals. We have, as we can see, we have more or less 7 that they are working now. We have one central coordination that the state government, the city, the government of the city, the air forces we have here that we call that it's the national force of the health system that we call Força Nacional do SUS. Also, they were here. So basically, we had one big general quarter to plan the actions, and in the capital, as you can see, like you have the heart, we have the pump, but deep when you go like through capillarities, we're gonna have the civilians working a lot. This is also, as I told you, we have this Força Nacional do SUS that helped us to transport one patient, one child that was isolated in one of the cities, that to another hospital had a better condition and an ICU that what the baby was needing. The shelters, it's another big problem at the beginning. We have 76,000 people in shelters now through the state. It was open really fast. This is the part I think that the civilians took really in front of the state, and they do a great job. They open in churches and gymnasiums, in schools, all over. We are putting some mattress, some blankets, and putting people together to at least they get dry and safety. We also had a lot of people making food to everybody, to those people. We have a lot of donations also of hygienes and cleaning products and everything. As you can see, all of this you can see in this picture would be multiplied for more than 400 shelters in all over our state, and it was a safe place for all those people. The supplies, as I told you, was really hard for us to get. Was basically donations and comes all over the Brazil. This is one of the planes, and it landed in the Air Force base camp. So it was not allowed at the beginning, but then we're starting to receive also the not military airplanes to land there. It was allowed now, and it's going to be used for some also some of flights later, because our airport, as you could see, it's gonna take us some time to get work to be working again. The medical response, as I showed you also, we have the stands at the beginning at the rescue points, but we have some medication, especially painkillers and antibiotics, and especially what we're going to talking now, it's for the chemoprophylaxis for leptospirose. We have this small rooms for stabilization for hypothermia, basically this. And if it was needed, we have some the pre-hospital service we could send to the hospitals. As I did the supports also, all of this, we have a lot of animals rescued by animals, so we have a lot of animal bites also. We do also the rabies vaccine from to them. Security, complicated. At the beginning, for the first 2-3 days was okay, and then the violence started. As you know, probably we have some gangs here, so they are all together in the shelters. It's not separated, so we have to have some problems there. We have some also problems of robbery of the boats and jet skis that the volunteers they left on the rescue points. Unhappily, you have also some sexual assaults in the shelters, so we also made separated for women and children, separated for the men. It was needed. So as we know at the beginning, we have the increase of the violence, and probably it's going to get worse for the next days. So this is the date of today. This is what we have then the data. More, we still don't have so sure about this in the end. So we have 157 deaths straight associated with the flood. 800 injured, is still 88 people missing. 500,000 people, no, more than almost 600,000 people displaced, and all of these of the population affected. When you see the map of Rio Grande do Sul, all these red points are the municipalities that were affected by this. 93%, 463 of 497 municipalities, or even if it was not with some deaths, but we have like the roads were blocked, some destruction in the infrastructure, something like this. Basically, our whole state suffered something from this flood. This is one of this is what we call all this operation that what happened here. That is Taquari. Taquari is one of the name of the river. Taquari 2, because unhappily we have this flood, not this big last year, but it happens in this city that is Taquari also, that it was also another flood of the river, and it now affected all of this, and we have all of these institutions working together to put our state back on foot. This is also more or less what we're using, and now our challenges now are trying to first of all, we need to clean. We really need to clean this mess, and then we're gonna think about the future, what we are going to do. Risk mitigation measures, we're gonna have to think about alert systems, evacuation plans that we don't have, prevention, it's gonna be done. We're gonna have to think about these pumps and all of this, we're probably going to have more of this through the next years, and also a plan to this disaster. How can we manage this disaster? We know that it's we train, and when it gets it's not so we don't follow the books, but it's much better when we know what to do, at least at the beginning. And just thinking about a trauma surgeon, I think about this is what happened, what is happening to us now. This is one of my patients. It took me 2 years to, it took us, better saying, me and the patient. So we have this enteric fistula from, he was a gunshot wound. He had this enteric fistula to work on. So we did the first step, that it's close this. After we closed the colostomy that he had here, and almost 2 years after the injury, we are able to close the abdominal wall. And this is what I think that we are now. We're still in this place. We still need to clean this mess and trying to get back on our feet. And after doing little by little, we're gonna be able to recover, to reconstruct our state. And we always gonna have this scar. This is impossible to forget. But we can also be better at all of this. And just to finish, this is our I think it's our main symbol of the state, that is laçador, that is the typical gaúcho, and also he was almost under the water. Thank you.
Maria Fernanda, please keep this for now. Kevin,
Okay.
can you disallow sharing screen, please? And then Roberta, you can manage the questions, please.
Okay. Good afternoon, everyone. I would like to thank Dr. Antonio Matos for providing this space for us, providing this space to discuss this tragedy. And we are very, very sad and tired, and this is totally uncommon to us. Always we used to see this kind of tragedy in other countries. This is the first time in our country. Then we are very, very sad about that. Beginning, would like anyone like to make some comments or questions for Maria?
Maybe Roberta, yeah, Dr. Ontrak raised his hand. Dr. Ontrak, Dr. Cassin, Dr. Frisby, they all have a lot of experience in this field as well.
Yes, I just wanted to ask, do you have any statistical breakdown of the distribution of injury versus illness and the sort of medical problems that needed to be taken care of? This seems unique in that probably a lot of the patients have non-traumatic illnesses, the infections, and many probably with hypothermia, which would be cared for by surgeons. But do you have any statistics yet about the distribution of medical problems resulting from these floods?
We don't have the dates about this, but for sure we didn't have an increase in the hospitals and the number of hospitalizations by now, because we're still, like, as I told at the beginning, we have some hypothermia. It was basically managed by these rescue points. Really, I think when you are talking with the volunteers, maybe 5 or 6 patients needed to go to a place with better conditions. It was not really complicated. Straight thinking about the flood, but now we know that for sure when the water really gets down and the people gets back to their places, we're gonna have the traumas, we're gonna have brain injuries, we're gonna have all the falls from high, we're gonna have the fractures. This is we know that is going to happen, and this is something that basically for me it's really is stressing, because as I show you, one of the hospitals that is responsible for 150, it's completely under the water. It's not going to be working from the next probably 2 to 3 months. We as the clinical, the doctors of this hospital, we are trying to talk to people to understand the importance of this hospital in this future that it's coming. That we know it's going to happen, and we don't have the facility, so the problem is going to be much bigger than now.
But Fernanda and Roberta, in Miami, you have a lot of hurricanes, and you have a nice plan here in the hostels. You prepare, you practice the table exercise, you had the team that stay during hurricane, then after hurricane, when possible, you switch the teams. And you know, here in Trauma Center, you know that during hurricane, usually don't have a lot of activations, but after you have the falls, have the burns, the electrocutions, etc., etc. But in this situation, it's a little bit different because you don't have a lot of access, and a lot of hospitals are down. So what's the expectation about the chronic disease patients? So the ones that are not taking the insulin, not treating hypertension, when do you think they're going to start to come, or they have the remote or hospitals or the field hospitals are going to take care of these kind of patients? What about the disease that come with these are you seeing leptospirosis, any kind of dengue fever, anything else growing that you're expecting to have a big wave in the next few weeks?
So basically, this is the field hospitals made for. So basically but this is something that happened, Marcos. We have a lot of medications, of donations of medications, so we could distribute this to the shelters. So the chronic diseases, they got their drugs. So insulin, all of this, we have a huge donations of this. And this is what's managed to be sent to the shelters, not only in Porto Alegre, but as I said before, by helicopter, we could send this medication. What it was really getting complicated is some of the hospitals that were blocked between the city was blocked because the roads are not on, to get the hospital medications that is a little bit more expensive, and it's not so easy to get, like antibiotics, IV antibiotics, and sedation and medications for sedation, and ICU as muscle blockers and all of this. This is what's at the beginning. So we talk to the hospitals to see the situation and to get some of these medications and distribute to them. For the complication,
Maria.
Yes.
Maria, I wonder. Excuse me, but I'm a little bit interested in knowing how quickly you got clean water in there.
So this is also another problem, because we still have some places that has no water. We have here in Porto Alegre, we have, as we joke here, now we are specialists in the cleaning stations of water. Now we know to the city which one. So we have 6 of them, and 5 of this water distribution stations, they were damaged. But now only one is damaged, that is one of the islands. So probably we got about 7 to 10 days here without cleaning water, running water, tap water. So, but now almost all the city here, it's with cleaning water. We have a lot of donation. This is for drinking and all of this. We have a lot of donation from from other states and other places from Brazil. They send us, because even to buy here, it was not possible because the truck could not get here. So okay. also this, but now we have water. So the hospitals, they need the trucks, the pump to get some water. Also, this was a problem. We have to reduce to cancel some procedures, elective procedures, that it was not timing really necessary at that time, we cancel in the major hospitals, and to reduce the consumption of water and all the resources, because we know that it was a little bit complicated, and also because we have some places that we have more of the staff, the nurses and all the rest of the staff that works in the OTs. They were affected. They could not get into the hospital. They were so blocked also because of the roads and all of this. So also we have this problem. The person was okay. It was able. Their house was okay, but they could not get into the major hospitals because the roads were destroyed or under the water. So we have also this. As I remember seeing in one of about 9/11 that it was exactly this. The major response hospital was really close to there, but then the people could not get to. They could not change the shifts and all of this, and this is what's happening here also. Some people are sleeping inside their hospitals because they could not leave. It was not possible to leave at the beginning.
Yeah, I hope, Dr. Assim, I have a question. So last week we were talking, and a lot of reports of very similar to what happened to Katrina here in the United States. So a lot of people not leaving their house because the gangs are stealing everything. A lot of violence against women and kids in the shelters. So how is the situation right now? Then I'm going to ask somebody here if anybody has anything to add regarding security and anything else, how to manage this kind of situation when the criminals rule the city because sometimes the police is not available and they are concentrated trying to do other things. Roberta, how is the security situation now in Porto Alegre?
Actually, we have support of all police of Brazil, from army, from civil police, all of them. They call Força Nacional Brasileira. There is a lot of this kind of support. Maria, não sei quantas mil vieram.
I don't remember, but we have all of this. We have the army. We have the three military forces here, as we said, like Air Force, Marine, and the Army. We have here. We have this federal policy that it's a bit more like intelligence issue. We have our military and our civil policy also on all of this. We have some other states that send some also to increase this force, because we know, and as I said, like now we have some gangs and they are all together in some shelters. So this is like it's almost like something to explode with all the other issues that was before. So, and all the stress that we are having. So this is gonna be not a good mixing. And but we have this now. It's something also that it's in the plan for the future. As you asked, Martos. So have basically this field hospitals that we are having is for the disease that are about to come. One of these fields is really close to one of the we call like a press hospital, like a fixed one, that it's not a complex, it's not a hospital, but we can do this first aid, we can do some we can see the patient that is not so complex that need to go to hospital, but need to be seen by somebody and start some antibiotics, and if needed, they're going to be transferred to a hospital, to a major complex. But this was the problem before. We don't have place to all this. Normally by this time we're starting to have really the respiratory diseases because it's our winter. We normally it's humid and we have this problem. So now we have this problem. We have one in Porto Alegre. We have one of the the private hospital that also was was evacuated. So we have one hospital less working, and so we're gonna use the other hospitals to this. So complicated. It's not gonna be easy for the next 2 to 3 months for sure.
Maria Fernanda, I have
Can I
here
ask
in the
a
meeting
question?
Dr. Zonsanon. She's one of our deans in medical school. She's very strong about mental health, burnout, wellness here, and there's a lot of burnout happening for sure for patients, for civilians, and for the medical personnel as well. So, Dr. Sananj, your comments. I know you have a lot to say, please.
Yeah. So Maria, thank you very much, and Roberta for presenting. I know that it's overwhelming just to watch your presentation about what happened, and I know we've all been following it in the news. When we looked at the post-hurricane situations that we have, in many situations, both for the providers and also the patients, mental health issues are a huge thing. And I know I'm an internist, so I'm not a trauma surgeon. So I'm just here because my interest in this area. But how are you handling, and what kind of resources do you need, really? Because this is something that can be done, not necessarily have to be done in person, but can be done remotely, and providing support for your teams and also going forward the patients as well. Just a question.
I think it's something that at least we learn from the others, and I think this is very important. The mental health, because we know that it's gonna increase the other problems. Yes, it started. Some of the shelters, they have some psychologists going there and with the displaced. We have some. Now we have the telemedicine, we can do it. So one of the medical situations, they are doing this consultation by video. So we have also the support. In the shelters also at the beginning, we have some psychiatrists exactly for the chronic patients, because we know that at that time with all the stress, they normally decompensate. So they were there to medicate, because it's different. Yeah. We know we have we are in burnout. We need to talk. We need to see a light, as we said, in the end of the tunnel. And it's one point, but also we have the chronic disease, the psychiatry disease. So it's kind of working. It's not perfect for sure, but I think it's working. We have all of this here. It's basically more in Porto Alegre, because where the huge amount of displaced people, because we took from the other villages, and almost is the same, but it's working, and not probably what the speed that needed, but at least it's starting, and it's something that it's on the view of the government and all of the structure to keep an eye, because it's important.
And for your teams who are providing care and all, do you feel like they have enough support, or did you put something special in place for them?
To be honest, I think they have the same. We're talking that I think for me it was the biggest was the volunteers that really going through the water to take people. We kind of, when they we try to talk, we try to give some advices, as at least not medicate for sure, but to understand. But they don't have this long-term support. This is I think the volunteers and the rescuers are the main I think the main issues are that they're gonna be probably in 1 week more, no more than that. They are burnt out. They're completely out. And we were seeing already this in the shelters. We have some people breaking down, which is common and it's normal, and we can see. But we're gonna see. But it's not 100%, but it's a little bit. At least it's working.
Good. Thank you.
I think someone asked about the blood. We started a huge campaign, all of this in the city for blood donation. And I don't know how it's now, but we don't, in my trauma hospital, we don't receive anything like that we're not with a good supply of this. This is something that I think it was really, really special in all of this, that we could see is really all the population working together. Like, I can donate maybe time, so I will go there and working for this. We have the restaurants that were not working, they were doing food. One of the good restaurants that we have here, they are doing food for babies, because no one thinking about the small children, and they could not eat normally, or they need like more the food a little not so solid, so they are doing this. This is something that was really impressive, was the response of the population for all of this.
Okay. Anyone more questions?
Dr.
Antonio?
Lanin, your experience with the hurricanes here. So I know that you are usually during the hurricanes you are leaving the hospital. So anything to add to advise to share with the people from Brazil?
Yeah, I mean, I don't think we've ever had anything to this degree that has shut down the city. I mean, thank God. I mean, it's probably coming at some point, but obviously it's early, but are you gonna, I guess, is there anything you're thinking of putting in place to help the next time something like this happens?
So basically, it's something that we are, as a society, as the Brazilian Society of Trauma, we are thinking about is, yes, okay, it's never, as I said, like, I was in Haiti after the earthquake, and never in my worst nightmare, I would think that I would be passing in my city, in my state, for something like this. And I was there and I saw what was the chaos. And that's why I'm telling all this that we're talking before about the violence and all of this, we know it's gonna happen. But as a society, we are planning exactly this. Okay, now we're gonna literally put our head through the water as a turtle, as I said, like we're doing like this. And when the water comes down, we need to plan. We need to think about, because this is going to happen again. We're not going to be, and it's not going to take like 80 years like it was, because the last one, as I said, it was in 1941. It took 80 years to again. So it's probably not going to take 80 years. So we're gonna need to be ready and to be trained and to be planned to what to do and how to do. This is something for the future, but not the future from 10 to 20 years, something from the next close future.
Dr. Sanonji, what to expect in terms of internal medicine disease like leptospirosis, this tropical disease, and tetano? What are expecting to happen in the next few weeks over there with all these patients that are underwater for weeks? Some
Exactly.
2 weeks, right? Yeah.
I think that Maria has covered a lot of the need for medications and stockpiling of the medications. But you think about tetanus and the type of injuries that you see. A lot of it is not necessarily reaching the level of the trauma surgeon, but hand injuries and all kinds of things that you see. People who are the renal dialysis patients or the patients with kidney disease who haven't had access to care, all of the things. This is what we see post-hurricane because of the problems with electricity and all of that when we're on the internal medicine service. And just the aftermath of the cleanup, as you said, all of the trauma that you see, all of the things that we see that just from injuries that go unchecked, but the tropical diseases, and also, as you mentioned, you're in flu season. Right. So, or you're coming into the respiratory virus season on top of everything. So a lot of busy and and kind of urgent patients coming in because of the disaster, but also the overlying of chronic diseases and just exposure to the things that they wouldn't have. So really, it sounds like part of the planning going forward has always been, when we look at it, like who is going to, the post-disaster planning is for the internist is probably where we focus the most energy because of all of those problems that go unchecked. But sounds like you've got it covered or have the supplies and are anticipating the same.
Yes, and at least as we have here a culture of vaccines, so also we have all of this in the shelters. We are given the flu shots and tetanus also, especially for the rescuers from the water. Come here, give me your arm, and we're gonna receive a shot. And they were okay. It was not a huge problem, but it's something that we at the beginning it was planned. We think it, and it was not really at the beginning, but we started to give the shots to everybody, and also in the shelters the flu, and exactly we're gonna expect all of this maybe in 2 to 3 weeks. All of this, and unhappily when we look outside, we still see that we have cloudy, so we have some clouds and it's gonna start to rain again.
It's not over yet. Yeah.
It's not over. It's not over. It's still
Yeah. And everybody knows I was in Brazil, very African in Brazil, and my friends from Rio Grande do Sul, the people that are here, that are working there, they are very good. They're excellent. This is one of the best states in terms of pre-hospital, intra-hospital organization. The trauma system is amazing. The pre-hospital system is incredible. They know what they're doing, and they did a lot of planning when they had the FIFA World Cup 2014. They prepared for mass casualty. They are on the top states in Brazil, and they are ready. But this completely overwhelmed. And then I think the biggest lesson that you can take that climate change are happening. You have overwhelming things happening everywhere in the globe, and maybe it's time to rethink all the plans, because something not going to be the usual, the normal. So the escalation of these kind of events can be really overwhelming. So maybe it's time for us to start to think, not the regular. It's not about doing a mass casualty simulation with a plane crash with 200 victims. It's something much different, much bigger than we are usually planning for our hospitals. That's maybe something to think about.
And I don't think we'll ever see the devastation in terms of the water that you have displayed and that you experienced. But we need to remember that our city, Miami, is basically, all of the hospitals are in a flood zone and very, very tenuous in terms of what can happen there as well. So taking a lesson from what you had experienced, I think, it is water. It can come very quickly, and we can prepare for hurricanes, but not necessarily for the massive floods. Remember last year, Fort Lauderdale had 24 inches of rain in 3 hours or something like that. So it was. I think we're just preparing for a different world, and these things happen much more quickly, unfortunately.
Yeah. So, Maria Fernanda, thank you very much for a great presentation. Again, we are here. Please, let's have another meeting in a few weeks to share what happened, your knowledge, etc. And I'd like Dr. Roberta Dalcin presenting slide to compliment you and to finish this meeting. Thank you.
Okay, thank you. I'd like to thank you once again for the support. And several states in Brazil have mobilized as well Brazilian colleagues that living abroad, who also contributed and still working for help us. Then I'm so glad to see you, to hear of you, and we are working hard, so hard. This is a lot of a lesson for us. Thank you for all. Thank you, Antonio.
Thank you all. Obrigado a todos. Força aí. Bye. Thank you.
Obrigada.
Obrigada.
Valeu. Parabéns. Obrigado. Força.
Obrigada.
Obrigada.
Tchau.
Thank you.